Early diagnosis of autism is important as it means your child will have the support and treatment from early on and they'll be able to function better independently. Signs of autism can be seen in your child from as early as 6 to 9 months but might not become obvious till around the age of 3. Signs of autism include difficulty in non-verbal communication such as avoiding or problems maintaining eye contact, not pointing or waving goodbye. Delayed or lost verbal communication such as not babbling or not saying more than 2-word phrases at age 24 months. Lack of social interaction such as not sharing toys or interests with others. Not playing with other children or playing with adults only. Repetitive behaviour such as lining up toys or hand flapping. Being too sensitive or not sensitive at all to light, sound, touch, taste or smell.
There are a number of specialists involved in both the diagnosis and management of autism, such as paediatricians, child and adolescent psychiatrists, speech and language therapists, occupational therapists, educational psychologists. So they'll be looking into the child's developmental history, such as any difficulties or trauma during childbirth, drugs used in pregnancy, age of parents, any family history of learning or developmental delay, including autism, and depending on the age, observing the child's behaviour and social communication and interaction in different settings, such as in the office, the home,
play school or nursery. Autism is not diagnosed in one visit or setting, and in most cases, your child will be followed up at different intervals, so if seen at 12 months, your child can be brought back, for instance, at 18 months and then 24 months. Your GP or health visitor is usually the first person that sees the child before they're referred, and mostly on history given by the parents or the guardian. Remember that some children are adopted, and in these cases, there might not be any family history that can be given. So there is no blood test, single test or tool that can diagnose autism, but the professionals might use one or more screening tools to help them in diagnosis, such as ADOS and DISCO. So let's look at some screening tools that are specific for autism, such as ADOS, otherwise known as the Autism Diagnostic Observation Schedule. This is the gold standard tool for autism and is carried out by psychologists and behavioural analysts. It is a 30 to 60 minute play-based assessment using a variety of semi-structured tasks to observe communication, social interaction and play. Then we have the MCHAT, which is the modified checklist for autism in toddlers. This is a parent-completed questionnaire that's used for identifying children at risk of autism and aimed at toddlers under the age of 3, i.e. between 16 and 13 months of age. You'll answer 20 questions about the child's behaviour, which usually takes 10 minutes or less. A child is classed at high risk at a score of 8 to 20, and this indicates referral to a specialist, but this does not mean they have autism. Another tool is the ADIR, or the Autism Diagnosis Interview Revised. This is used for children above 18 months and most accurate for children above the age of 4. However, unlike ADOS, it does not involve the child directly, and the interview is done by a trained researcher or psychologist with the child's parent or guardian focusing on the developmental history of the child. There are 93 questions on the ADIR looking at communication, social interaction and behaviour, and this usually takes 90 minutes. Then we have the DISCO, which is the Diagnostic Interview for Social and Communication Disorders. This is a semi-structured interview that looks at the child's development, behaviour and skills since birth up to their current day-to-day functioning. This picks up any patterns in behaviour over time that will suggest autism, and this can be done by trained psychiatrists, paediatricians and psychologists. There are other screening tools such as STAT, which is a screening tool for autism in toddlers and young children, and you've got the CARS, which is the Childhood Autism Rating Scales. These are tools which help with diagnosis, but a lot of physicians also use the diagnostic criteria in the Diagnostic and Statistic Manual called the DSM-5. The DSM-5 divides symptoms of autism into 2 categories. As mentioned earlier, problems with communication and social interaction, and restricted or repetitive patterns of behaviour or activities. To receive an autism diagnosis, a child must display all symptoms in the first category of problems of communication and social interaction, and at least 2 symptoms in the second category of restricted or repetitive behavioural patterns. Let's look at who's involved in the management of autism. Speech and language therapists. Speech and language therapists help in treating language and speech disorders. They will do detailed interviews with the parents and other professionals, as well as observing the child in different settings and making their own independent assessment. Their aim is to improve the child's non-verbal and verbal communication skills. They will help with the individual child's needs, such as in using longer sentences, understanding meaning of words and following instructions, making conversations and knowing when to take turns to make conversations, improving the articulation of speech, and for non-verbal communication, communicating using pictures through a system called PECS and use of sign language. For example, a child of little or no communication can show a picture that they want to use a toilet rather than soiling themselves. These methods have also shown to improve the child's verbal communication. Speech and language therapists would also support their adult or parent in how they communicate with the child and create an environment at home that's structured and meaningful for the child. Ideally, you want your child to start speech therapy as soon as possible, usually from 18 months or earlier, when language delay is identified, as this gives the child better chances. Occupational therapists. Occupational therapists help to develop fine motor and coordination skills like how to button a shirt, holding a fork, brushing the teeth, handwriting, doing puzzles as well as reading, and riding a bike, and social skills that would help them at home, in school, and other facets of life in order to function as independently as possible. They would usually watch and, with your permission, record the child's activities during the day, looking at their social interaction and what tasks they can do for their age. 70% of autistic children have problems with processing sensory information, and occupational therapists would help with this through sensory integration therapy to help the child deal with bright lights or touch, and working with parents using a sensory diet. A sensory diet is a group of activities designed to help the child meet their sensory needs and might involve fidget toys or chewing crunchy foods throughout the day. In addition to this, you'd expect your child to be able to be more focused on tasks, be able to express the emotions more appropriately, and play with other children. Paediatricians. These are child health specialists, and some focus specifically on developmental disorders. Your child would usually be referred by the GP or can be seen privately. They are involved in initial assessments such as history taking, examination and diagnosis of autism, and as part of the multidisciplinary team of other health professionals such as the social workers, psychologists, speech and language therapists, and occupational therapists that they can refer to. They would follow up your child as well as manage other issues the child might have or might not be related to autism. Health visitors. Health visitors are specially trained nurses involved in health promotion and development of preschool children. Along with GPs, they're usually the first point of contact if worried about your child's development or they might raise concerns themselves and advise you should seek opinion with the GP or the paediatrician. Educational psychologists. They help children in educational settings such as nursery or school by assessing their learning and emotional needs. They do not diagnose autism, but they are involved in helping the child meet their educational needs, looking at their strengths and weaknesses, recommending learning strategies, learning materials, and refers to other health professionals. There are different kinds of therapies to improve speech and behavior, but let's look at the applied behavior analysis. Applied behavior analysis, or ABA, is an established form of therapy for children with autism that uses rewards to reinforce positive behaviors and teach new skills. This involves one-on-one therapy for 40 hours a week. Parents and other caregivers are trained so that they can give the autistic child feedback in real time. Depending on the child's needs, this might include improving communication, social skills, personal care and schoolwork. ABA techniques include PECS, which is the Picture Exchange Communication System, using special symbols instead of picture cards, and early intensive behavioral intervention, mainly useful for children under the age of 5, which helps to discourage negative behaviors such as tantrums and self-harm, while rewarding positive behaviors such as giving praise or a toy to play with. So the good news is that as a parent or guardian, you are worried that your child has autism or does have a diagnosis of autism, then you're not alone. There is a variety of treatment options as well as autism parent support groups for advice and information sharing. It's also important knowing to look after your health and knowing when to ask for help or when you need a break, and getting family or friends who might be experienced in dealing with autistic children to help out. As for your child with autism, early intervention helps, and as your child gets older, symptoms tend to be more manageable, and you find that a lot of children who become adults can function independently or with some support, depending on the severity. Please, if you like this video, then like and subscribe for more health videos.